communication has changed the perspective on how consumers evaluate and treat their own health. Opinion leaders, marketers, and healthcare providers use different channels of communication, such as print advertising, commercials, television shows, movies, product placement, and more to prescribe medication and treatment options. Using two theories, I will analyze new communication methods used by the healthcare industry. Direct-to-consumer advertising and medicinal communication informs consumers about health conditions and their treatment options to encourage doctor-patient communication through less detailed messages. The Food and Drug Administration has assembled a guideline with a criteria for drug companies to follow in order to regulate the validity and content of each message presented to the consumers. It is known that prescription drugs have side effects and treatable components, but not all are proven. Therefore, marketers use different sources of information suppliers and visual marketing strategies in order to comply with regulations, but to perceive the consumers. Some advertising attempts still get reported to the FDA as they do not comply with the regulations. 328 reports of the potentially untruthful and misleading promotions were found in the past year.
The process direct-to-consumer advertising starts with a marketing team who will put together a message and idea to be advertised while noting the legal aspects they need to include, like the side effects. Next, the company will introduce a word-of-mouth channel, usually sourced through pharmaceutical representatives, to doctors and a few patients. The doctors would then have some knowledge on the new drug to continue the word-of-mouth trail to some consumers. At this point, the product would then be portrayed in different forms of advertising, all with the intention for consumption. The steps then rewind back to inquiring about the product of growth of sales.
In the 1900s, regulations on drug ads were limited. Side effects were not as well known, and the effectiveness of drugs were also unknown. The following two print ads present medication and their functions. The first one contains a lot of information, but no side effects, and the second uses children to target emotional techniques, but again, only provides the name and the function of the product.
Today, these ads appear comedic as they show heroin and cocaine as remedies to coughs and toothaches, and now they are illegal drugs, whereas before they were considered useful medication. These modern-day ads use sex and beauty to cover up the side effects that come along with them. Symptoms include pain, constipation, nausea, swelling, extended erections, headache, dizziness, fatigue, shortness of breath, slow heartbeat, chest pain, heart attack, dry mouth, loss of vision, infections, fever, bleeding, bruising, depression, personality disorder, painful swallowing, ulcers, rash, addiction, tremors, sweating, insomnia, loss of memory, anxiety, vertigo, weight loss, weight gain, blood clots, stroke, and death.
The print ads just presented use humor, sex, and beauty to direct the focus away from its legal message. The truth is, taking a quick glance at the ads would make it difficult to determine what they were trying to sell. The following televised ads use the same techniques as well as voiceover effects to mix the messages, as the human brain can only focus on one thing at a time. On top of that, the brain can only process 60% of the information provided. Other techniques include changing the source of the message, such as an expert effect like a doctor or a common person that we can relate to.
I can't even believe I'm talking about this. I'm going to be brutally honest. Sometimes I don't make it to the bathroom in time. You think, wow, I've got to do something about this. Ask your doctor if Ditropan XL is right for you. I get up about 2 to 3 times a night. It's time to kind of deal with this. I encourage women to talk to their doctors.
Lunesta, don't drive or operate machinery until you feel fully awake. Walking, eating, driving, or engaging in other activities while asleep without remembering it the next day have been reported. Abnormal behaviors may include aggressiveness, agitation, hallucinations, or confusion. In depressed patients, worsening of depression, including risk of suicide, may occur. Alcohol may increase these risks. Allergic reactions such as tongue or throat swelling occur rarely and may be fatal. Side effects may include unpleasant taste, headache, dizziness, and morning drowsiness.
Direct-to-consumer advertising allows drug companies to advertise and communicate new products to infiltrate the new market. This new form of communication for the medical field exposes consumers and future patients to possible health problems that may or may not have effective solutions. In addition, it causes more and more people to become hypochondriacs, as the symptoms listed are as common as cough and runny nose. With society today, we listen to authority figures in media. We think of them as those who have the right opinion. This leads into how mass media uses its power to manipulate our needs and opinions related to medicine. The two-step flow theory was designed to examine the connection between media and people's influence in affecting behaviors of the public. It shows that an idea can be translated among people as long as the right person or group is doing it, as well as using the right channel of communication. The goal is to persuade the public into trusting the idea of the opinion leader. The opinion leader can range from a parent, doctor, teacher, celebrity, or a trusted friend.
With this diagram, we can apply the steps to ads, commercials, television shows, and movies, and how they affect our perspective and consumption of a prescribed drug, and how we view the medical atmosphere.
The first clip is from the movie Love and Other Drugs, where the main character is a pharmaceutical representative. A new drug is being launched, and they are learning how to deceive doctors and patients into buying their product regardless of its side effects.
This is not a pill. This is tens of millions of dollars in research. This is thousands of hours of hard labor. This, ladies and gentlemen, is software. Your training will last 6 weeks. Each of you will leave here a fully qualified healthcare professional.
That's 33% fewer phone calls for you at 4 a.m. That's 33% less angry. Ah, shit!
Your job will be to go fight illness. Off-label uses are benefits not yet recognized by the FDA. But you can boost sales by hinting at what these uses are.
Hello, doctor. Did the prescribing Zithromax prescribing Zithromax? Oh, yo! No doubt! Prescribing Zithromax. Zithromax.
Zoloft, a drug approved solely for the treatment of depression. Off-label uses: alcoholism, bulimia, PMS, smoking, social anxiety. Is there a question?
Zoloft has been associated with suicidal ideation in teenagers.
Unproven.
Proven, unreported.
Next, we have a clip from a popular television show based out of a hospital. The effect of having drama and action series shot in a hospital alters one's point of view on how the medical field functions. It can create passion or fear. Who would want to be cut open in a broken elevator with interns, unless you knew you were going to survive? This clip is from an episode of Grey's Anatomy.
Take these. Go after the scalpel.
Alex, come on. Alex! Ventilate. I got it.
Trusting someone and their opinion can be helpful as long as they are in the right position. The two-step flow theory allows us to question the intentions of drug companies' advertisements and the messages we are supposed to receive from watching hospital shows. The medical communication industry has developed with new forms of communication. We can rely on telehealth providers, the internet, and what they say on TV. But there are always underlying messages that can be more harmful than what they present in benefits. Just because it's not reported does not mean it's not proven.